Hi everyone, my name is Karina and welcome to Universal, a channel about psychology and complex human nature. I'm very glad to see you here today. I would like to discuss with you how coronavirus affects our mental health. This is a very serious subject, and I feel like it's getting ignored for some reason. Like, people don't really admit that they're very worried nowadays, and it does affect them, all the anxiety, uncertainty, all the mixed messages from governments and so on. I would like to discuss with you my observations, recent stats, and which groups are particularly vulnerable to poor mental health in the middle of such crisis. Maybe you'll find yourself in one of those groups, and you'll realize that whatever you feel, if you feel low, if you feel very anxious, that it's normal. Or maybe you will realize that someone requires more of your attention and more of your kindness and empathy. I also would like to discuss with you why conspiracy theories gain popularity in times of crisis like this one, and which psychological patterns are behind irrational beliefs and doubts. So let's dive into it. I assume most of you are concerned about coronavirus and its long-term consequences. COVID has influenced many areas in our lives, from stretched economy and closure of jobs to children sitting at home without the opportunity to see their friends, sometimes for months. Self-isolation and quarantine, they have changed our daily routines 180 degrees, and for many resulted in increased loneliness, anxiety, depression, insomnia, alcohol and drug use, as well as increased self-harm and suicidal behavior. Lockdowns all over the world have led to an increase in cases of domestic violence, when women and children, but men can be too, it's not a matter of gender, while living with an abuser, they find themselves trapped and not able to escape. Since everything is closed, mental health crisis services are overcrowded or non-existent in some countries, or there's simply no money to become independent, no way to earn this money. We already had a pandemic of psychological disorders in the world prior to COVID, and recent polls show that the number of mental illnesses increased by 20% after the outbreak of COVID. Many, for the first time in their lives, developed serious psychological problems, addictions, and for those who were already sick, everything only got worse. For instance, for people with panic attacks, health anxieties, people with agoraphobia, when they fear to leave the house, many fear not only crowded spaces, but the opposite, empty, deserted streets, and we saw that a lot recently. People with OCD suffer like never before, especially because of newly introduced policies to wash your hands for prolonged periods of time and use sanitizers everywhere to mitigate the coronavirus infection, therefore increasing people's existing irrational fears about germs and getting sick, as well as their overall responsibility to prevent major events. People with eating disorders have also become very vulnerable in the world of COVID. Firstly, disruption to daily routines and restrictions on going to the gym increase anxiety about weight and body shape and negatively affect diet and sleep. Secondly, social constraints are depriving people of social support, thereby potentially increasing the risk of eating and other disorders by eliminating protective factors, for example, opportunity to see a psychologist or visit a family member. Previous lockdowns, they cancelled a lot of psychotherapy sessions, and a huge number of people, they didn't receive psychological help in time, and they were left alone in the problems. And to be honest, the situation didn't change for many, since the waiting list to see a psychotherapist have only grown. Thirdly, returning to eating disorders, the fear of infection can trigger symptoms due to the fact that people begin to follow so-called healthy diets aimed at increasing immunity, but in fact, these are very restrictive diets that are more likely to harm than benefit. Orthorexia, for example, if you haven't heard, it's an eating disorder which is characterized by an obsessive desire to eat very healthily. When people worry about the quality of food, they avoid eating food prepared by others, they bury themselves in food research and restrict themselves in many food categories. They fear sickness and they also show signs of malnutrition. Nowadays I see more and more people with their destructive diets and the way they eat. Also, it needs to be emphasized that people with pre-existing mental illnesses, they are 65% more likely to be diagnosed with COVID than people without. So addressing mental health burden is crucial. Next, more emotional outbursts are observed in people since March 2020, caused by feelings of uncertainty, stress, panic, fear of infection, fear of death, fear of not getting basic necessities like food or meds, and so on. Millions of people have lost their jobs. The most affected people are those employed in informal sectors, where work is more on verbal terms than on terms of a contract, like building sectors, especially in low-income countries, hospitality, childcare. The burden of debt has risen when people are unable to keep up with their bills and fall into physical and mental burnout. The connection between poverty, debt, and mental health, it's not new. In general, people living in financial distress are at increased risk of mental health problems and lower levels of well-being in general. A quarter of people with mental health problems, they have debts that they cannot afford to repay. Unemployment reduces the quality of life, social status, lowers person's self-esteem and eliminates the desire to achieve life goals. Depression kicks in. With COVID, all these problems, they have only doubled or even tripled in some regions. Doctors, nurses, and paramedics who work directly at the front of service are highly susceptible to overexhausted mental health. Long working hours, lack of adequate protection and supplies, lack of effective medication, seeing death of their co-workers after getting COVID, social distancing and isolation from their family and friends, and overall stress with dealing with patients and their families. All this, no doubt, affects mental health. As a result, the medical personnel's effectiveness at work is gradually decreasing, and it becomes difficult to deal with situations in calm and serene manner. Also, COVID can have serious negative consequences for the mental health of elderly people and people with disabilities. Again, we see increased stress, anxiety, and depression levels in this group. Often, older people, they depend on younger generations in their daily needs, and self-isolation can cause serious damage to the family system when everyone is on edge and there is no external support. Institutional staff, they become overwhelmed. A vicious circle begins when patients are frightened or irritated. They start shouting or they show other types of emotional outbursts. They bite, fight, don't eat, don't sleep. This annoys those who are looking after them, and they in turn also break down and start shouting. Hatred begins, which only worsens the already shaky state of patients. Mothers who have experienced postpartum depression or who still have it, they're also very vulnerable. Studies show that every seventh woman experiences postpartum depression. This is without the COVID epidemic. Imagine how many have it nowadays. Staying at home with all the housework and children to be taken care of without a social life and support leads to an increased depression and inner struggle to overcome it. Many mothers, they feel overwhelmed by everything they have to carry on their shoulders. And due to social distancing, the number of places to relax with children is very limited, and even most public parks also periodically closed. The inability to share problems and complete isolation naturally have a bad effect not only on mothers but also on the babies. Are you feeling overwhelmed by looking after your baby? Do you feel completely isolated, alone, bored, empty? Feel free to share your stories in the comments below or write to me on Instagram if you don't want to reveal your problems publicly. I will listen to you and I will respond. All of the above doesn't yet include being actually ill with COVID. Now, add to all the stress mentioned earlier the coronavirus itself, poor health, the inability to breathe properly, to get out of bed, exacerbation of existing conditions like cancer, long-term physical consequences, extreme chronic fatigue, loss of your loved ones due to COVID, in some cases the loss of very young relatives and friends, sometimes whole families, and not really knowing whether this will happen all over again. Among these, many conspiracy theories develop that authorities want to control everyone, they want to modify our genes through vaccination, that 5G somehow plays a role, that COVID doesn't really exist, that soon the world will be captured by lizards and Illuminati, and so on. It's not clear what to do and what to believe, isn't it? Where can you run? Certain psychological patterns, they can explain why conspiracy tends to gain popularity during social crisis. The human mind, the threat of the virus, isolation, and social media, they work in tandem here, creating the perfect combination to drag people down the rabbit hole of conspiracy theories. People, they need to believe in something, whether these beliefs come from religion or science. Their usefulness lies in destroying the void left by uncertainty, and there's a lot of uncertainty today. The desire to understand the world is a central motive in conspiracy theories. When people don't have an answer to a question, they tend to come up with it. Trying to determine the cause and effect is essential for stability and consistency in our understanding of the world. The bigger the threat to our existence, the more people try to find an explanation why. Conspiracy usually offers a sense of some control in a very ambiguous situation. Thus, these theories, they allow people to explain how the situation came about and who can be trusted. This creates an illusion of being able to predict and foresee future events. Also, the human mind tends to use shortcuts to simplify information through cognitive biases and heuristics. By preferring simple information and using as little mental effort as possible, people actually, they tend to accept a given explanation if it suits their needs and not make further checks, or they become overly biased by conducting research only on one perspective, ignoring all other possible explanations. People also tend to use the same belief to explain as many uncertainties as possible. This pattern is especially evident in conspiracy, where every problem can be explained by the actions of very powerful and dangerous people like Bill Gates, pharmaceutical companies, or politicians in general. Conspiracy advocates, they usually distrust the authorities. As scientific consensus changes, as new information emerges, governments and health experts sometimes they contradict themselves, exacerbating this mistrust. Moreover, the reaction of the authorities to this particular pandemic was sometimes vague or even strange, which only led to disappointment and the search for alternative solutions. My advice to you would be to double-check everything and be open to completely opposite explanations. Don't put yourself in a box of limited beliefs and ignorance. Sometimes it takes time to understand what really has happened, and maybe that's the only thing we should accept for now, that we're searching for answers, but we don't have them yet, and that's absolutely fine. We can deal with that. The main question here, can the world return to normal? I believe that yes, the world can come back to its normal state, and we can overcome today's problems and our fears about coronavirus. We can eliminate coronavirus. It can be the problem of the past. But what's important here, to win this battle, we need to be together, not divide ourselves into different groups. For example, now there's a huge majority that wants to be vaccinated. Another majority doesn't want to be vaccinated, and I see friends, I see families falling apart because they fight with each other who is right and who is not. It's not about being right or being wrong, it's just about trying to understand what's really happening. We need to respect people's freedom and that they can make decisions for themselves. Just try to be kind, show more love, show more empathy, show more support to people around you. If you realize that you need help, don't be afraid to ask for it. If you need professional help, try to find one. It's very important not to isolate yourself, but do the opposite. Talk about your feelings, talk about your emotions. Thank you for joining me. I wish you a fantastic day and I see you soon. Bye.